Hey, this is Adam. This is my first video in my series about why I went to Europe to have my heart revascularized and why I felt the need to leave the United States to do that. So, this first video is the 6 most common questions I get about going to Europe and having this done. So please follow along and let's go. I'm Adam, and I flew from Mechanicsville, Virginia to Milan, Italy to have my heart revascularized using metal-free PCI. I did this because the options in the United States are very limited, and if you want to find out more about what I did and why I did it, then please keep watching. So hey, let's get started. So 2 months ago to the day almost, I was in Europe and I had metal-free PCI. And what that is it's a variation on your classic stents and angioplasty that you can get here in the United States, but I was in Europe for it. So the first question I get is, was I on vacation and had a heart attack or had heart trouble, or what actually happened? And the answer is no. I had a heart attack almost 6 months ago here in the United States, and I basically wasn't treated. And I went, after 6 months of doing research, I went to Europe specifically to have this procedure done. It was not something that happened when I was there, and no, I was not on vacation, although we did make a vacation out of it, and we did go see some sites and do quite a few things. PCI is not a very invasive procedure. It's just the type of PCI I had, I could not get done in the United States. This brings me to the second question I get most commonly is, how did you know you were having a heart attack? Or a variation on that, which is, what did it feel like? And I get this from a lot of people. So the answer is, it hurt. That's how I knew I was having a heart attack. I was by myself at the river, at the house I'm having built, and basically I started having chest pain. Now, I had been having chest pain before, but this was different. So I was standing right here and I was wondering about the job the plumbers had done. Just then it hit. And when it hit, it started off as just regular run-of-the-mill angina chest pain, but then it turned into something more serious. And after about 3 or 4 minutes, I went and said, this is some of the most serious chest pain I've ever had. And I went and got some nitroglycerin, which I had available. And that didn't help. It didn't change it. I was here by myself. It got worse and worse. I got a little dizzy. And just as I was wondering what to do, my contractor pulled up. He took one look at me and said, we have to get you to the hospital. And off we went. So throughout the drive to the hospital, I was awake and conscious, and I certainly was feeling a lot of pain. And it was getting worse and worse as we got there. By the time we pulled in to the emergency center at New Kent, I stumbled inside and told them I am having a heart attack. What it felt like throughout this ride was someone reaching into my chest, pinching the bottom of where my heart is, and twisting as hard as they could. That's what it felt like. They sat me down, they shot me up full of drugs, they did everything they could, and after about 2 hours or so, they confirmed that I was having a heart attack. They did this through the cardiac enzymes, primarily troponin, and they immediately put me into their convenient free shuttle bus to their downtown campus, where I ended up going into the ICU, where I was for 24 hours, and then I was there for about 5 days. So what happened while I was in there for 5 days? This brings me to my next question, is why did I go to Europe to have this treated instead of doing it in the United States? And the answer is that when I was first in the hospital, they basically didn't treat me. It turns out that I have something called diffuse artery disease. And diffuse artery disease is different from what they call normal blockages or focal blockages. Here in this graphic on the right, you can see the different types of blockages, and down here at the bottom you can see diffuse disease, where the entire vessel is full of blockages. For me, my LAD, my RCA, and my PDA, three of your primary arteries in your heart. The LAD, of course, is your widowmaker. For me, those were all 70 to 85% blocked down their entire length. In fact, the very tiny sections near the end were completely blocked. You couldn't even see them. They were close to 95% blocked. And there's not a lot you can do for that. So they chose not to treat me. I have diffuse artery disease, and instead they do what they call medical management, which is the other of your three choices in the US, where they just give you a lot of pills. And even today, I'm still on 14 pills a day. So that's what was wrong with me. And it turns out there's a fourth option. And that fourth option is really good, really effective, really safe, and readily available, and not expensive. And that's what they use all over the world, except in the United States. And that's called drug-coated balloons. It's the first line of defense for what I have. It's the first line of defense for most coronary artery blockages in every country on the planet. So I had a treatment called metal-free PCI, which is entirely metal-free. After they're done, there's nothing left in my arteries. They say nothing left behind, because I'm young enough that stents will cause nothing but problems starting in about 8 years. Stents are a great option to save your life, but they're not a great option to have stuck in your heart arteries for the rest of your life. They're problematic. They don't really tell you that. Some people certainly can have a short, fat stent put in and they can go for 30 years without problems. But the smaller the diameter of the vessel they need to do it, and the longer that stent has to be, it gets worse and worse and worse and worse. And with diffuse artery disease, you don't have a lot of options. Drug-coated balloons. Fourth most common question. What are drug-coated balloons? Well, drug-coated balloons have been around the world for 20 years, and they are now the front line of defense and the only defense against diffuse artery disease in your heart, diffuse coronary artery disease. They're not available in the US, and I'll do a whole video on drug-coated balloons, but that's what I had done. I also had something called a bioresorbable magnesium scaffold. What that is a stent made out of magnesium, which dissolves in place over 12 months, because stents don't need to be permanent. They really are just scaffolds. What they do is they push the blockage out of the way, and then you put that stent there to keep that blockage from immediately bouncing back. But once your arteries heal in that new position, the stent's no longer necessary. However, it's stuck there for the rest of your life, causing problems. And with a bioresorbable magnesium scaffold, after 12 months, my artery will be free and clear. The magnesium scaffold, that is 20 years away. Nobody is testing that anywhere in the US right now. It is not on anyone's radar to be approved here. What I had was the third generation scaffold, which is the newest one. It was released, it got the CE mark in Europe back in March, and I'm one of the first people to have it. It is going to be the standard around the world in probably 5 years, because they're so useful and they are so good and they serve a real need. And they ain't going to be here in this country until I'm a really old man. The next question, and one of the most important questions, is, so how did it go? How am I feeling? Did it work? And the answer is yes, it worked, and it worked really, really well. In fact, it's kind of incredible, to be quite honest. I went to Milan, Italy, and I saw a legend of a cardiologist named Dr. Antonio Colombo, who is one of the leaders on the planet in the use and dissemination of information regarding DCBs. And he did a job on me, I will tell you. He did a major 3-vessel PCI, where he revascularized my LAD, my PDA, and my RCA, all of those from stem to stern. He did 7 drug-coated balloons, which is a lot, and actually quite long ones at that. He did 1 bioresorbable magnesium scaffold. And to do all of this, he had to prep the vessels and prepare them for the DCBs, and he had to do a total of 24 inflations over 2.5 hours while I was in there. Now, truth be told, in the days following this and the weeks following this, I was in a lot of pain. And It got to be quite significant one morning where I was in my front yard and I had chest clutching, fall to your knees type of pain. So they ended up going back in on July 11th and they did another heart cath here in the United States just to make sure there were no complications, of which can happen during PCI. There weren't. It just was that, they did an awful lot. Basically, every artery of my heart was, major artery of my heart was revascularized. So it was quite painful. It worked. And here is a snapshot of exactly what it looked like and what they did.
So quickly, everyone, here is a view of what was actually done to my heart in Europe. So this image on the left was from my right after my heart attack in December of 2023. And this top vessel here is my Widowmaker, your LAD. What you find here is that the proximal portion, this first portion here, looks really good right until you get to this first branch point, and suddenly there's this blockage here that's about an 85% blockage, and then after that is this diffuse, very thin, wispy, fully plugged vein artery that goes all the way down till it just kind of peters out. And I can move this around. You can see the blockage a little better here. You can see how wispy thin this is. If I move it around, it's there's portions of it right here that get very thin. There's other portions of it that just don't look healthy down here at the end, at the tailing end of it. That is diffuse artery disease. So this was in 3 vessels. This is just one of them. The other 2 looked a lot like this. These 2 vessels here is my OM and my circumflex artery. Those all look pretty good. Now, jump ahead 6 months after I got back from Italy, and this is what it looks like today. So I can stop right there. Here where the blockage was, that's where they put the scaffold in. And you can see a good, healthy, good flow artery all the way down to the very tip. So you can compare these 2 views. Even the getting more flow, you can even see these look a little better. All the offshoots look a little better. Everything looks a little cleaner, and I clearly have good flow all the way down to the very teeny tip of my artery. Now, that's what was done to me, and this is what drug-coated balloons can do for someone with diffuse artery disease, where over here there isn't really much they can do in the United States without drug-coated balloons, because you can't get a good target for cabbage. You can't put stents all the way down because they just cause trouble. Here, I have no metal left inside me, metal-free PCI. These vessels are 100% clean and clear, and there's no metal to mess me up into the future. And if it ever comes back, we can just do it again. So that's what I had done in Italy.
So at the end of all this, there were quite a few comments from the team here in the United States who took a look at it after the fact. And that includes doctors who helped me find my way to Italy. And quotes included, "This is quite a fantastic result. Nothing short of miraculous. You basically have a brand new LAD. It's quite incredible. My team was totally blown away and they learned an awful lot after looking at your case." And one of the most impactful statements, "Going to Italy was probably one of the best decisions I've ever made in my entire life." And that came from the PCI specialist here in the United States. So that's a lot. So the 6th most common question I get is actually a series of different questions that can be summed up by asking, how did you get this done? How did you learn about this? What was the process of getting yourself into a hospital in Italy? What was the Italian healthcare system like? All of those questions can be bundled into one, and there's a lot of answers to those, so I will try to summarize quite quickly here. The answer is, I had to do everything on my own to figure this out. The cardiologists and the doctors here in the United States were less than helpful, and in fact, nobody gave me information about drug-coated balloons, and I only caught it by accident because I happened to go to a doctor who was doing a clinical trial of drug-coated balloons here in the United States, who mentioned offhand that there's these things called DCBs and maybe I could get into the trial. Spoiler alert, I did not get into the trial. The reason is quite simple, is that there's a control group and we all felt that the control group was in fact worse for me than doing nothing. So that is how I first heard the term DCB, was from him. And that led me on a journey of discovery on the internet. And with time and a lot of luck and a lot of perseverance, I eventually got connected to a doctor in Italy who really helped me out. Now, I'm going to do a whole series of videos on that topic, because how I got from point A to point B is really actually quite an interesting story, but it didn't just happen. So you hear a lot of times in the United States, people say, we have the best healthcare in the world. Spoiler alert, we don't. That's all I can say. I'm going to do a whole bunch of videos on the Italian healthcare system and what that was like. But needless to say, it was a wonderful experience. The Columbus Clinic is a beautiful antique building that they have renovated into a great hospital. It had wonderful facilities. The cath lab looked like going into something out of Star Wars. Here's a picture of it right here, and that's exactly what it looked like when I got wheeled in there. They had a trattoria right there in the hospital. My wife was quite a fan of that. It was quite an experience. Before I conclude this video, I just want to say I am doing a series of videos because there's a lot of other questions that people have. Those include, why didn't they help you here? Why do cardiologists not talk about this with patients here? Why are we not given the option for this? Why do they not use drug-coated balloons here? What's it like doing medical tourism? How did you set this up? And how did it come to pass that you came to do this in Milan, Italy? How did you know how to get that done? What is it like to advocate for yourself specific to cardiology? What does that mean? How do you learn about and evaluate the imagery that you've seen me use here? There's a whole class in that. How do you learn the lingo? There's a lot of things you have to know before you can just get this done in another country. And there's a lot more to it. And again, I had to go figure this out all by myself. And that's one of the reasons I'm doing these videos, to try to help others, because this is a great solution for a lot of people. And you need to know how to get it done, because it doesn't just happen. A doctor here isn't going to just give you the name of someone to call in Europe and set this up. It doesn't work like that. Lastly, I do want to help folks if they have questions. If you would like to email me, please do. The email for this channel is mydcbjourney@gmail.com, but I get a lot of spam, so make sure you put in the subject line the word Italy in all caps, because I'm going to do a filter and only read emails that have the word Italy in the subject line. I will try to get answers to your questions back to you. With that said, thanks for watching.